Health to Life News.
High school and college students have taken on a dangerous habit. They're partying with Ritalin prescribed to their peers. And reports are that parents are also popping the drug, sometimes using their own kids' supplies, hoping it's the perfect weight loss, high-energy boost. Experts add that this phenomenon doesn't only occur with Ritalin, and other prescription drugs are being abused as well. Do they realize the risks? Ritalin is most frequently prescribed for treatment of attention deficit hyperactivity disorder, ADHD, which is thought to affect as many as 5% of school-aged kids in the U.S. The hallmarks of ADHD are lack of concentration, restlessness, and frequent frustration. The drug has always been controversial. However, recreational use and abuse of Ritalin is a growing trend that the Drug Enforcement Administration, D, and other watchdog groups have noticed. Recently, 15 middle school students in the Chicago suburbs were disciplined for selling or abusing the drug. The D lists Ritalin as one of its drugs of concern. As with other controlled prescription substances, Ritalin has high potential for abuse. That may lead to severe psychological or physical dependence, Regine Waite, a D spokesperson, tells Airport from the D identifies Ritalin as one of the top 10 controlled drugs most frequently reported stolen. It's sold on the street as vitamin R and R-ball. In many cities, Ritalin abuse has moved from the club scene and now is available to younger adolescents in other social situations, many of which are billed as no-alcohol events, Paul Ulrich, a Chicago-based D spokesman, tells. One national school survey conducted by the Institute of Social Research at the University of Michigan shows that in 1997, almost 3% of high school seniors were using Ritalin without a doctor's order, up from 1% the previous year. Another survey shows 7% of all Indiana high school students used Ritalin for non-medical reasons, and 2.5% reported using it on at least a monthly basis. Also, since 1990, there has been a six-fold increase in the number of estimated drug abuse emergency room visits associated with the use of Ritalin, according to the Department of Health and Human Services. Like similar drugs, high doses of Ritalin cause rapid heart rate, high blood pressure, nervousness, and insomnia. In teenagers and adults, it acts more like speed. Jeffrey Bernstein, MD, an emergency room physician at Jackson Memorial Hospital, University of Miami, tells. There are also the complications you get from high blood pressure and rapid heart rate, like heart attacks, strokes. There's something called amphetamine psychosis. People who take it continuously for a long time have hallucinations, he says. Typical dosage Ritalin is slow-acting, but when many pills are crushed and snorted or injected, the high comes quicker, says Bernstein. Danger comes in two ways. The drug is psychologically addicting, and injecting the crushed pill form is fraught with complications, says Bernstein. A good amount of the pill is talc and doesn't get absorbed by the body. This can cause blood clots in the lungs, brain, and heart. The drug can also cause bacteria to infect and destroy the heart valves. All can be life-threatening, Bernstein tells. Parents are also getting involved either in acquiring the drug or abusing it themselves, drug abuse officials say. There have been reports of parents obtaining Ritalin for their kids, paid for by Medicaid, only to turn around and sell the pills to drug dealers. Such scams have been uncovered in 7 states. Parents who abuse their children's medication are nothing new. Also, the D has received numerous reports of students who gave, sold, traded, and/or abused their own Ritalin medication or that of a sibling, friend, or classmate. School nurses, principals, and teachers have reportedly been involved in stealing the drug even from children's supplies at school. Says Bernstein, Ritalin abuse is not a new phenomenon. This has been around at least since the 60s. The phenomenon of parents using Ritalin as speed, that's been going on since I was a kid. Ritalin abuse is way underreported, says Bernstein. I think most physicians have a fairly high level of suspicion. When a child needs it more often, when it accidentally got flushed down the toilet, or whatever. We have drug seekers coming into the emergency room all the time. They've lost their prescription. The dog ate my prescription. They'll say anything for drugs, including Ritalin. When I was in medical school, there were a large number of medical students who used Ritalin when they studied, Bernstein tells. I know a lot of college kids now are abusing it as a study aid. People use it to stay up later. People use it so they will be more awake and function better during the day. And some people just like the way it makes them feel. As a weight loss drug, Ritalin is a bust, he says. It will kill your appetite at least temporarily, but there's no evidence that it does in the long term. You become accustomed to it and eat anyway. Rarely will you catch ADHD patients abusing Ritalin, Karen Hochman, MD, Assistant Professor of Child and Adolescent Psychiatry at Emory University School of Medicine in Atlanta, tells. In fact, the thinking is that it may prevent that by treating the core deficit of the disorder, which is inattention, hyperactivity, and impulsivity. Kids have more school success, more social success. They don't get into as much behavioral trouble, they have less substance abuse overall, says Hochman. Other kids are sometimes the biggest risk to ADHD kids, Hochman adds. They may try and extort the drug out of them. You have to be careful who you tell you're on this. As a stimulant compound, the risk of abuse has always been there, Catherine Cunningham, PhD, tells. It certainly is not in the same category as ecstasy, cocaine, methamphetamine, which have very prominent effects. It seems we would have heard more about it than the whispers we're hearing now. Cunningham is a pharmacologist at the University of Texas Medical Branch in Galveston. More studies of the issue are needed, James Perrin, MD, tells. Abuse is talked about to a degree, but I wish there were better data. A lot of people can give individual stories here and there, but I'm not aware of any good data on this. Perrin, who is director of pediatrics at Harvard Medical School, Massachusetts General Hospital for Children in Boston, helped write recently released guidelines for physicians prescribing Ritalin for ADHD. As a street drug, Ritalin does have a few advantages, says Perrin. It has relatively few side effects compared to some things teenagers use. So in that sense, a lot of middle-class teenagers think they will not only get high, but it might help them do better on a statistics test. There is a variety of reasons why, at least on an anecdotal basis, we know this has been a fashionable drug to try, but there is very little evidence in terms of scope. Tracking the trend has been Thomas Clark, a research associate with Health and Addictions Research in Boston. While he's still compiling data from a recent survey, Clark suspects Ritalin use will be in the range of about 5% of 12th graders. You always see higher use in most drug categories in ages 18 to 25. The trend tends to go up in young adults, says Clark. The under 25 age group are probably the ones abusing Ritalin. Federal agencies report Ritalin, a prescription drug used to treat attention deficit hyperactivity disorder, is becoming more popular as a recreational drug. It's one of the top 10 controlled prescription drugs reported stolen and has a high potential for abuse. Reports show parents are abusing the drug as well as teens. One expert notes legitimate Ritalin users usually are not abusers. Doctors said it's important to be careful who knows about a child receiving Ritalin by prescription, since others may try to gain access to the drug through the young patient.